A hysteroscopy procedure can be painful. However, many patients either feel no pain at all or just mild or moderate pain and are able to chat through the procedure. If you do find the procedure painful, then we can always stop at any stage or give you a break. For a small number of patients, they find they can't tolerate it, and we stop and then discuss carrying out the procedure under a general anaesthetic when you're asleep on another day. We ask all patients to take some painkiller tablets about an hour before the procedure, and we do have available gas and air, which is a gas that you can inhale to help the pain during the procedure. If you need us to stop, please just ask us to stop if it's too painful. When I start the procedure, all that we'll feel is a very fine telescope with some water coming through it. So that is not painful, it just feels a bit cold and wet. As the instrument goes through the cervix, that's a slightly tighter space and it can cause more pain for a few seconds. And then when the little device gets into the cavity of the womb, there's then more space and it tends to be less painful again. At any stage, I can turn the fluid off, which is what's generally causing the pain, and that will hopefully allow the pain to dissipate. The procedure can take anything from 5 to 30 minutes. In general, it's about 10 minutes. Things that will make it take longer are if the cervix is tightly closed and we need to put a local anaesthetic injection in order to be able to open it up a little bit, or if you have large or multiple polyps that need to be removed. Most people will bleed a little bit after the procedure. What you'll notice initially is some fluid and water coming out that we've been using to do the procedure, and then you'll get anything from between some spotting to possibly even a slightly heavier bleeding. Generally it goes on for a few days, but we ask that if it goes on for more than 2 weeks or it's getting very heavy, that you contact us on our contact number in order that we can check whether we need to see you again. You may experience some pain or discomfort after the procedure. Occasionally people will feel a bit dizzy or lightheaded. We do recommend that you carry on taking simple painkillers like paracetamol or ibuprofen if you're not allergic to them during the day and possibly for the next day. If you develop a fever or very severe pain or there's a smelly discharge, please contact our nurses in the gynaecology unit. We'll make sure you have this telephone number before you leave the department. You can go about your normal life after a hysteroscopy. Some people will choose to take the afternoon off work or to rest at home, but there's no reason why you can't go back to work if you feel comfortable to do so. We do generally advise that you avoid using tampons, avoid having sex, and avoid going swimming until the bleeding has settled down, just because of the theoretical risk of you developing infection after the procedure. Yes, you can travel after the procedure if you want to. There are no restrictions on where you can travel or what type of flights you can take. You're very welcome to bring someone with you, whether that's a partner or a family member or a good friend. They can stay outside the room while you have the procedure, or they can come and sit in the room with you while we do the procedure in order to give you some support. However, it's not strictly necessary, and if you don't want to bring anyone or you don't have anyone to be with you, our nursing staff will be very supportive of you and talk through everything that's going on. We encourage you to have breakfast before the procedure and to have something to drink. This is because it is likely to help stop you feeling unwell or sick during or after the procedure.